Welcome to this training module for the Substance Abuse Traffic Offender Program, also known as SATOP. The purpose of this training is to provide our contracted agencies important information for both our administrative personnel and also our frontline staff on SATOP requirements and best practices. And the goal is to improve the screening, placement, and program services across the state in working with our impaired driving offenders. This training is not all-inclusive. It's simply an overview of several important aspects of the SATOP program. So please make sure to become familiar with the Division of Behavioral Health certification standards and contractual requirements for SATOP, as well as outpatient treatment certification requirements. In accordance with our certification standards, staff with responsibilities for the administration, education, or assessment function of the SATOP program, or combination of those, need to complete a training program offered or approved by the division. Prior to 2009, core training on SATOP requirements was available at regional training facilities, and those regional training facilities are no longer available. They don't offer that anymore. Up to this point, there has not been a more global SATOP training on the essential components and requirements of the program, and this training was created to meet this need with the goal to improve program processes. This training is going to cover the essential components of SATOP to include its mission history, staff requirements, screening and program placement, SATOP programs and record requirements, comparable programs, policy and procedure implementation, and surveys and program documentation. The Missouri Substance Abuse Traffic Offender Program is a statewide program of community-based education and treatment programs that are designed for individuals arrested for alcohol and drug-related driving offenses. As you can see, the mission of SATOP is to contribute to public health and safety in Missouri and inform and educate these drivers as to the hazards and consequences of impaired driving. Moreover, it is to promote safe and responsible decision-making regarding driving and motivate for personal change and growth. Just to give you a little bit of history of SATOP, the Missouri legislature enacted law in 1982 which established the need for education and rehabilitative interventions for offenders with alcohol and drug-related driving offenses. The original 10-hour education curriculum guide was developed back in 1984 and was known as the Alcohol-Related Traffic Offender Program, or RTOP. All offenders, including repeat and persistent offenders, were required to complete RTOP as the only option of intervention up until 1993. So if you had 1 DWI, you would complete RTOP, 2 DWIs, 3 DWIs, and so forth and so on. And in 1993, the General Assembly of Missouri passed key provisions within Senate Bill 167 to increase the state's efforts to address impaired driving. And this included the need to include individual screening for all offenders referred to the program and funding to develop treatment services for repeat and persistent offenders. Based on the work of a DWI advisory group, the Substance Abuse Traffic Offender Program, or SATOP, was developed. As this legislation became effective on July 1st, 1994, intervention, treatment, and rehabilitation services have become essential components in efforts to address impaired driving in Missouri. In 2001, House Bill 302 and House Bill 308, House Bill 302 and House Bill 38 were passed, which directed the Department of Mental Health to create a treatment demonstration project within its existing appropriations and develop and certify a program to provide education or rehabilitation services for individuals determined by the division to be serious or repeat offenders. So in 2002, SATOP added a demonstration project named the Serious and Repeat Offender Program, or SROP, for high-risk DWI offenders. The initial pilot project for the SROP was deemed a success, which resulted in the expanded implementation of that program in 2010. The SROP has become an effective option for those high-risk offenders assessed to have a substance use disorder. As a treatment intervention, the SROP is tailored to meet the specific needs of the repeat offender and it incorporates a variety of evidence-based practices to enhance recovery and lower the risk of DWI recidivism. One of these effective practices is the use of medication-assisted treatment as appropriate in conjunction with other therapeutic interventions. According to the Department of Mental Health's General Program Procedures, all DMH-operated, licensed, certified, accredited, or funded providers must have a background screening completed and documented in their personnel file prior to performing duties. Staff who have been found guilty or pled guilty of a disqualifying crime, including those with an SIS or an SES, must go through the exception process prior to consumer contact. Senate Bill 229 made changes to the list of disqualifying crimes requiring an exception in order to work at a DMH-operated, licensed, certified, accredited, in possession of deemed status or funded provider. And more about the qualified professional. Staff that conduct education and or the screening or assessment functions must have not had a suspension or revocation of the driver's license within the preceding 2 years, not had a citation or been charged with any state or municipal alcohol or drug-related offense within the preceding 2 years, except when found not guilty, and also must meet credentialing requirements of the Missouri Credentialing Board. So responsibilities for qualified and trained staff. The agency shall ensure that staff possess the training, experience, and credentials to effectively perform their assigned duties, and qualifications and credentials of staff shall be verified prior to employment, with primary source verification completed within 90 days. Ongoing primary source verification is required by contracted agencies to ensure that credentialing is in good standing. A copy of the credentialing is required to be placed in one's personnel file. That copy must be initialed and dated by the staff member that has seen the primary source verification, that's seen the actual certificate. And all staff who provide SATOP services or are responsible for the supervision of persons served shall complete at least 36 hours clock training of clock 36 clock hours of relevant training during a 2-year period. Okay, so SATOP and credentialing, as the Substance Abuse Traffic Offender Program is a specialized program, staff that work in that program must meet specific credentialing requirements in order to provide services for the education and treatment needs specific to the impaired driving offender. In order to conduct SATOP screenings and provide education in the OEP, the ADEP, and the WIP, one must possess certification of a SATOP qualified professional, which is also known as an SQP. Also, a SATOP qualified instructor, or SQI, is eligible to provide the educational components in those programs. To be eligible to provide the assessment, the education and counseling services in the clinical intervention program and the serious and repeat offender program, staff must meet the minimum requirements of a qualified substance abuse professional. An SQP meets the minimum requirement to be considered a qualified substance abuse professional. Also of note, a recognized associate substance abuse counselor, RASAC 1 and 2, can provide individual and group counseling services as long as they're under the supervision by a supervisor that has successfully completed clinical supervising training. Okay, so the SATOP qualified professional, in order to be credentialed as a SATOP qualified professional, a person must hold a qualifying credential of at minimum as a certified alcohol drug counselor or higher from the Missouri Credentialing Board. In addition to that, the candidate must meet the following criteria: have to complete 6 hours live ethics, perform 10 offender management unit assessments, that's 10 SATOP screenings, receive training on the ADEP workbook, observe 1 ADEP course, observe 1 offender education course, and 1 weekend intervention program, and also perform 2 individual weekend intervention program sessions, individual sessions. Okay, so the Qualified Substance Abuse Professional, or QSAP, that definition can be found in the Department of Mental Health's core rules for psychiatric and substance abuse programs. That's on the DMH's website, which is not a standalone credential, but moreover a designation for those who meet minimum requirements. And in the standards, you're going to find that a qualified substance abuse professional is a person that demonstrates substantial knowledge and skill regarding substance use disorders by being one of the following. And it lists there, you can see on the slide, either a physician or qualified mental health professional who is licensed in Missouri with at least 1 year of full-time experience, a person who is certified or registered as a substance abuse professional by the Missouri Credentialing Board, or an individual who is within 1 year of meeting one of those above criteria and has a department-approved written training plan. Now, beyond the individual staff requirements in SATOP, there are also agency-specific requirements. Agencies must comply with certification standards, the core rules, the outpatient treatment standards, if applicable, for the SIP and the SROP, and program standards published by the department. Agencies must comply with contractual requirements and be familiar with program bulletins as established by the Division of Behavioral Health. Agencies must comply with established program-specific guidelines as established in the SATOP manual or published elsewhere by the division. And in addition, agencies must have their own set of internal policies and procedures. And also noted, for the purpose of this training, there are specific program-related contractual requirements, and a few of those include agencies must conduct a BAC test at least once a week in the clinical intervention program. The ETG test is optional in the SIP, but is encouraged to enhance compliance of sobriety. Contracted SROPs are required to offer medication-assisted treatment and have the ability to either provide that treatment or refer for MAT services. And out-of-state comparable program completions are processed by central office only. First thing we do in SATOP is screen the offender, and the proper screening of an offender is vital to ensuring that that specific individual is placed into the appropriate level of intervention based on his or her individualized need. There are several important elements that are part of this screening process, and that includes administrating the Driver Risk Inventory 2, or the DRI, obtain the blood alcohol content record from the time of the offender's arrest, if possible, obtain a driver's license record which is no more than 2 weeks old, obtain background information. We need to verify in CMOR any previous episodes of care regarding drug and alcohol treatment. And when these clients are in our office getting screened, we need to monitor their affect and any physical cues for signs of drug use, and conduct a structured interview of the offender with additional screening questions. So all the components of the screening process are essential for the proper screening and program placement of a client to the appropriate level of intervention. And if you have questions regarding the screening guidelines, you can refer to the screening and referral criteria, which is in your agency's contract amendment, or contract attachment R, I believe is the attachment. Now, once we have screened our clients or our offenders, the offender assignment screening is valid for 6 months. And the offender is entitled by state statute to have a judge review to make a determination on the program placement recommendations. In other words, the judge can, an appropriate judge can review our screening guidelines and make changes if he or she deems fit. That judicial review must occur in the Associate Circuit Court in the county where the screening was completed. So that's not screening, that's not county of offense, that's not county of residence, it's the county where the screening was completed. If an offender files for a judicial review prior to the end of the screening shelf life of 6 months, another screening is not required. So looking at the levels of SATOP, SATOP is structured to offer 4 levels of intervention based on the needs of the offender, and the first 2 levels of program services are primarily education and program content, where levels 3 and 4 are structured to provide drug and alcohol treatment. Levels 2, 3, and 4, the WIP, the SIP, and the YCIP, and the SROP, offenders are eligible to apply for financial assistance to assist with the program cost. So let's take a look at some of those levels. Level 1 program is the Offender Education Program, or OEP. It is structured to provide adults 10 hours of drug and alcohol education. The program also covers the laws and consequences related to impaired driving. And similarly, the ADEP, or the Adolescent Diversion Education Program, is also a 10-hour education course for individuals under the age of 18. The program is required for those offenders who have been arrested under abuse and lose, minor in possession, and zero tolerance offenses. So the Level 2 program is the Weekend Intervention Program. And that program provides 20 hours of education and intervention conducted in either a supervised environment approved by the division or at a provider office location over a 48-hour period. Now that's changed a little bit from past years where it was conducted only in a supervised environment. The division is now allowing providers to provide that program at their office. That program provides meals and may provide appropriate sleeping arrangements for participants if it's held in a hotel, as it has in the past. The Level 3 program is the Clinical Intervention Program, which is a 50-hour outpatient drug and alcohol treatment program, and that consists of 10 hours of assessment and individual counseling, 20 hours of group counseling, and 20 hours of group education. And as you see there, 10 hours must address impaired driving issues. Also considered Level 3 program is the Youth Clinical Intervention Program, or the YCIP, which is a 25-hour program for high-risk and high-need young adult offenders. The Level 4 program is a serious and repeat offender program, and that consists of at least 75 hours of drug and alcohol treatment in no less than 90 days. 35 hours of that total must be group and or individual counseling. And some of the criteria for clients being placed into the SROP include a BAC level of 0.15 or higher at the time of arrest, meet diagnostic criteria for a substance use disorder, determined to be a prior or persistent offender with 2 or more impaired driving offenses, and the arrest resulted in administrative action by the Department of Revenue. Now, in addition to those 4 levels of programs, every now and then we will have a client that comes to us that has had some sort of treatment or education outside of the SATOP network. Those clients can successfully complete their SATOP requirement if the program that they've completed is deemed to be a comparable program. So the requirements for out-of-state residents is they must obtain a drug and alcohol screening at a state-certified or nationally accredited agency after the date of their most recent impaired driving offense. And then they need to complete the recommendations of the screener, and that must be at least 10 hours of education. Once they do that, they can submit a completed comparable program form along with payment of supplemental fee to Jefferson City to the SATOP department. As a Missouri resident, an offender must receive an assessment and complete a program at a state-certified or nationally accredited drug and alcohol treatment agency. And once that occurs, they must complete a minimum of 120 hours of treatment during a period of no less than 30 days. Of those 120 hours, 40 hours must be individual and or group counseling. Once that happens, the offender can submit a completed comparable program form along with the supplemental fee to an OMU. If a Missouri resident wants to complete a program that's out of state, there are the following guidelines. They must be attending school or have employment in the state where the program is completed, and complete the assessment recommendations, or complete a minimum of 120 hours of treatment from a state certified or nationally accredited program. So now that we've kind of gone over the different levels of SATOP, let's move on with some personnel file requirements. And there's certain things that we have to have in our personnel files, and that includes the employee's hire date, the position, the documentation of 36 training hours every 2 years, a background check, documentation of required credentials, primary source verification of those credentials, and an annual driver's license report. Now, those personnel files need to be organized in a way which is clear to the department if they're ever auditing those files. The record requirements for a screening, so when you're putting together a file for a client coming in for a SATOP screening, you need to have documentation of the completed screening that's been conducted by the qualified SQP. It needs to be signed and dated by the SQP. The amount of time spent on the DRI-2, the scores, the summary of the screening results, and there's certain client rights and grievance procedure that needs to be documented and signed. You'll have, of course, the A form, which makes a recommendation that you also give a copy to the client, copies of any paid receipts, copies of receipts that they've paid the fee for the screening, and also an updated driving record. One important thing to note is that you must also have a signed release of information to the Department of Mental Health and the Department of Revenue in their file. And there are additional record requirements for the OEP and ADEP. You also have to have a notice of offender assignment, an A form, in their file, a completion form once they complete, also known as the C form. Again, you're going to have release of information to the Department of Mental Health and the Department of Revenue. You're going to have your client rights and grievance procedure documented and signed. You're going to have either your OEP or ADEP course activity checklist, as well as your pre-test and post-test, and those tests need to be scored. In addition, specific to the ADEP, you must document the effort that you made to involve their parents and the result of those efforts. Moving on briefly to the record requirements for the weekend intervention program, there's also several things that must be in the file. You're going to have the offender assignment form, the admission date, and the discharge date, so that's typically going to be a Friday through a Sunday. You're going to have signed release of information to Department of Mental Health and Department of Revenue. Signed consent for inspection of their person and belongings, especially if the program is being held in a hotel. And again, signed client's rights and grievance procedure. You're going to have a non-emergency medical checklist form with the blood pressure noted. You're going to have pre- and post-tests for the weekend intervention program, and those will also need to be scored. There's going to be documentation of the individual session that you conduct throughout the course of the weekend. You're going to have a program evaluation form and documentation of an assessment, and that assessment needs to include the following components: legal, social, occupational, physical, psychological, financial, and alcohol and drug problem assessment and recommendations. For the treatment levels of SATOP, so we're talking the CIP, the YCIP, and the SROP, those record requirements, you're going to need to make sure that you're in compliance with all the outpatient certification standards, and also specifically for SATOP, you're going to want to include a consent for treatment, evidence of orientation to the program. You're going to have a start date that's within 6 months of the screening date, and that's going to be for all the programs, OEP, WIP, etc. Also in this record, you're going to have a rights and grievances form, our release of information as we've gone over. You're going to need to make sure that you complete a treatment plan within the first 3 outpatient visits. So the first 3 times that they're at your office after the screening doesn't count towards that. The first time that they're enrolled in the program, you're going to need a treatment plan within 3 visits. You're going to need documentation of weekly BAC screenings in the SIP. And you're going to need to document that you have completed a treatment plan update within 30 days of services, and a minimum of 10 hours per week is going to be offered for the clinical intervention program. You're going to need the A form and the C form once they complete that program. Now, in order to assign an individual to the clinical intervention program or to the SROP, there are required screenings and an assessment that must be completed prior to assigning them to that program. These include the following, and these are mostly found in CMOR. They're the ASI, service needs, the HIV, STD, TB risk, the non-emergency medical evaluation, treatment history, and presenting situation. Now, contracted agencies are required to complete an individualized treatment plan on each consumer with the following documentation requirements. That treatment plan must be completed within 3 outpatient visits and needs to be indicated by signatures and dates. Treatment plan must contain measurable goals and outcomes and must note the services, supports, and actions to accomplish each goal or outcome. Now, when we're doing that, we also note the responsible party to accomplish those goals and objectives. And if you have family involvement, you need to have that notated as well. Have a projected time frame for the completion of each goal or objective that's on the treatment plan, and note the estimated date of completion or date of discharge for each level of care. An additional documentation requirement in the SIP, YCIP, and SROP is the discharge summary or continuing care plan. And that documentation is required when transferring a consumer to a different provider, when a consumer successfully completes treatment, or when a consumer discontinues treatment services. Now, the discharge summary must include dates of admission and discharge, the reason for admission and where the referral came from, the referral resource, diagnosis or diagnostic impression, a description of the services that was provided and the outcome that was achieved, the reason for or type of discharge, whether they're successful or unsuccessful, documentation of the medical status and needs that may require ongoing monitoring and support, and an aftercare plan. Okay, now that we've gone over some of the program documentation requirements specific to each client, there are also requirements that are applicable for the agency. So we'll go over those. Each agency must have a governing body, and that governing body needs to provide fiscal planning and oversight, ensure that organizational planning and quality improvement in service delivery happens. Governing body also establishes policies to guide administrative operations and service delivery. Basically, as an agency, how are things going to happen? Ensure responsiveness to the community and individuals served. Delegate operational management to an executive director, and designate contractual authority. So who has the authority to enter into contracts with the state. The agency also must have annual fire inspection at each site, maintain personnel files, maintain consumer files, maintain and execute a quality improvement plan, and adhere to core rules, certification standards, and the requirements of the contract or contracts that the agency holds. And they also must have a working policy and procedures. So all of this is covered in much more detail, of course, within the certification standards. Agencies, as I mentioned, are required to have policies and procedures, and those policies and procedures basically cover how the agency handles different situations that may occur as a business. Now, a policy is a statement that reflects the moral, ethical, and legal position of an agency or organization in regards to a particular issue or activity. Procedures must be clear, specific, practical steps that are to be followed consistently by the whole agency or service in order to meet the policy statement. So the following are examples of topics that may be covered under your agency's policy and procedures. So service delivery plan, consent for services, what happens if a client refuses to sign paperwork, waiting list, who's eligible, who's ineligible for services, client rights, release of information, on down the line here. Now, contracted agencies are required to have a full certification survey once every 3 years and a safety and basic assurance review and billing service review annually. Based on analysis of recent surveys, the following findings are noted to educate you about things that the state has that have been found on recent reviews and audits. So personnel files, one topic that comes up is a file may be missing background screenings or missing primary source verification for degree or credentials. You must see the original piece of paper which that is printed on and document that. Also, files tend to be missing documentation of required training hours. For the OMU, survey findings frequently found are no documentation of the amount of time spent on the DRI-2. So once you complete an interview with the client after they finish the test, you must note how much time you spent in that interview in your notes. And also a common finding is the screener did not refer to the offender to the appropriate level of intervention based on the screening information. And again, those are spelled out in attachment R to your agency's contract. Common survey findings for the weekend intervention program include no consent for an inspection form found in the file, no blood pressure readings documented on the non-emergency medical evaluation checklist, no follow-up screening documented on those who have elevated blood pressure, and also information on the standard means test must be completed in its entirety. Common findings for the clinical intervention program include group education documentation did not specify the amount of time used to view movies or other media presentations. And just as a note, that shall not comprise more than 20% of the educational component. Group counseling notes did not contain sufficient documentation regarding the intervention used, the group process, or the outcome of the session. We found pre-typed or verbatim group or individual progress notes. The agency did not document actual times for services. And as of note, it's expected that there will be short breaks between sessions. Also, you should know that no class shall continue for more than 2 hours without a break. The time for break shall not be counted toward the required hours of education. So other things include treatment plans not individualized to that specific client, and the treatment plan or the treatment plan update not signed by the counselor and the consumer. More survey findings for the SIP include missed appointments not documented within the file, and if a client misses an appointment, efforts to contact that person shall be documented in the individual's record, and that effort should be initiated within 48 hours unless circumstances indicate a more immediate contact should be made due to the person's symptoms and functioning. Also, when we send Folks, for drug screens, that needs to be documented properly. And also, we found discharge summaries missing. The drug panel testing documentation should include the date of the screen, the drug categories tested, testing results, and the signature and date of the staff completing the service. And additional findings for survey findings for SROP programs. A lot of these are kind of the similar things to what we talked about for the clinical intervention program. Counseling notes did not contain sufficient documentation. Notes also may have lacked a description of the outcome or group response to the session. No indication of screening and or use of medication-assisted treatment. And also, again, individualized treatment plans lacked required documentation.